Chronic pelvic pain is a very common problem that women develop. It's difficult to evaluate and manage a woman that has pelvic pain because there are so many different potential reasons for it. As a urogynecologist, I specialize in patients who develop pain from their bladder, patients who develop pain from their vagina and the skin around the vagina or the vulva. Also trained as a gynecologist, there's a variety of different pain disorders, things like endometriosis and pain conditions that involve the uterus. And then finally, there are pain problems that can result from disorders of the bowel. So you have this anatomic area that encompasses different organs. All of these organs have the ability of, unfortunately, producing pain. So one of the big areas of urogynecology is understanding and developing the expertise in identifying and differentiating these different potential pain disorders and then honing in on how best to evaluate and manage them. When we look at how prevalent pelvic pain is, again, because it's a very subjective symptom, it's hard to get a hardcore number, but some basic statistics. 12% of women who have a hysterectomy have it for pelvic pain. We do 600,000 hysterectomies every year in the United States, so that's just one segment of pelvic pain. There's a significant number of women who can develop pain within their bladder. It's certainly a fairly prevalent problem. As a woman ages, she can develop pain in her vaginal canal due to loss of hormones. That can be as prevalent as anywhere from 20 to 30% up to 50% of women as they age and go through menopause. So it's a problem that significantly impacts a lot of women from a quality of life standpoint. The challenge is identifying the culprit and then appropriately addressing it. Once you identify the specific cause, the treatment may be nothing more than injecting that area with some form of long-acting medicine, steroid, anesthetic solution. It may involve some surgery to take down some scar tissue or some other complication that may have occurred from surgery. It may involve correcting a problem that has occurred, such as a problem with prolapse. It may involve, in rare situations, a hysterectomy if the culprit of the pain is the uterus. So again, the key is identifying the etiology, making sure that the problem is not a life-threatening problem, understanding the impact from a quality of life standpoint on how it's affecting a woman, and then identifying an appropriate management plan to hopefully address it and improve her quality of life.